Good morning. Welcome once again to the Network Breakfast. Absolutely. Today we're going to talk about Medicare Advantage plan versus Medicare Standard, the regular Medicare that everybody gets. And you've heard many commercials from different companies using celebrities to get your attention. And we'll look into some of those and see why there's so many of the commercials and why do they run so often. And I think you'll know after we finish this few minutes of presentation. But for starters, we're going to let our assembled group here introduce themselves and say good morning to you and tell you about themselves a little bit. So to start off, I think we'll start off today with Scott Morrison. Good morning, Scott.
Good morning, everybody. My name is Scott Morrison. My company is Discovery Photo. I am a full-time, full-service photographer, have been for 30 years now. We do everything from legal, corporate, industrial, architectural. We even do business headshots, modeling portfolios, and on the weekends we crash parties. So it's a little bit of everything. I'm also very active within the movie industry, and we have 2 movies, full-length feature films that are going to be starting here, one September 15th and one the middle of October that I'll be working on and hopefully get distribution, and that'll be great. My name is Scott Morrison, company's Discovery Photo, when image counts.
That'll be great indeed. Thank you, Scott. Thanks for being here. We're going to say good morning to Chris Walters. Good morning, Chris.
Good morning. Chris Walters with see-through windows. That's correct. Real windows, not Windows 10. I'm a wholesaler of vinyl replacement windows. I cover from Port Clinton to the Pennsylvania border, Cleveland to Canton. I will go take a look at your property and within 24 to 36 hours, email you a quote. And the problem we have now is the window manufacturers are a little behind. So you're looking at about 6 or 8 weeks before we get the windows and 2 weeks to install. Thank you.
Very good. Thank you, Chris. Thanks for being here. And now we're going to ask Mike. We're going to ask Mike to introduce himself and tell him a little about himself to all of you and to us. Good morning, Mike.
Good morning, all. Mike Bentley, and I'm from the Brooks and Stafford Company. We are a full-service insurance agency, and my area of experience is in the area of health insurance, and I work with small businesses. I work with non-for-profits, those transitioning coverage from group coverage to individual. We work with the marketplace and Medicare products. Mike Bentley from the Brooks and Stafford Company.
Excellent. Thank you, Mike. Thanks for being here. It's always great to see you. Now we're going to say good morning to the prettiest member of our group today. That would be Trina Gigax. Good morning, Trina. So wonderful to see you. All right, Scott comes in a close second.
I was going to say, he looked a little insulted there. You guys are handsome. That's the difference. My name's Trina Gigax. I'm a freelance writer, copy editor. I work with, as Jeff likes to say, so your bits, your bios, and your blogs to make them better. I work on all kinds of writing, newsletters, web content, letters to employees, newsletters, any kind of marketing materials, to make sure the message is clear and the writing is crisp and concise and that it's easily readable. That's what counts. It's the reader. Trina Gigax, Fresh Eyes Reading.
Excellent. Thank you, Trina. Thanks for being here. Now we're going to continue on with the Medicare Advantage program presentation. And there's a lot of information here that we'll cover in a short period of time. And you'll find something that'll be interesting to you. Just pay attention and you'll see why there's so many of these commercials and all the fine print. And what do you think about all these commercials? And we'll delve into that right now. I'm going to share my screen with the rest of our group here and with you. And you'll see a fully recognizable face. Those Medicare Advantage commercials. We're going to deal with the fine print. What do you think about these ads? Do they get your attention or turn you off? Do you think you want to jump in and try this and see whether this is something you want to do and switch over? You have to unenroll in order to do that, and then you re-enroll into Medicare Advantage. And we're going to find out why that is and why there's so many. So let's move on to the next panel, and that would be this one. How about the Medicare insurance ads you see on TV? Can you really get all of the benefits they mention in your area? And I'm going to give a special thanks to Chris Mercier from the Roger L. Daniel Insurance Agency. They compiled some of this information. I want to give them credit for that. So now, if you watch television, you have no doubt seen a commercial for Medicare insurance. Some of these commercials have famous athletes deliver what they call important information if you are on Medicare. These commercials may even list Medicare benefits you deserve or should be getting. These benefits are usually found printed in big and bold letter, encouraging you to call the toll-free number to find out more or to see if you qualify. Commercials like this must be truthful and not misleading according to federal law. What is said during the commercials is truthful in the literal meaning, but there are many details that are left unsaid, including important information needed to make an informed Medicare plan decision. Do not get sucked in. The commercials you see on TV or the ads that are delivered in your mailbox follow basic templates, highlighting benefits, cost, and call. Often they are colorful and full of pictures. Marketers may also use basic print and letters that look very official. Both of these methods are enticing you to call a marketing agency. Now, here's what they tout. Benefits, cost, and call. Benefits. Get the benefits you deserve, like rides to medical appointments. Let's drill down a little bit. Original Medicare Parts A and B do not cover benefits like this. These are known as benefits for daily maintenance. They're not available without enrolling into a Medicare Advantage plan. Medicare Advantage plans are the only type of Medicare insurance that can provide benefits like this. However, not many Advantage plans offer these types of benefits. You will want to review the Medicare Advantage plans available in your area. Benefits can differ between states and even counties within a state. And how about the cost? All of these benefits may be available to you at no cost. You've heard these athletes and celebrities say these lines. All of these benefits may be available to you at no additional cost. Well, let's drill down a little bit. A television commercial or printed ad might offer a $0 premium or mention available benefits at no additional cost. Make sure you're looking at the small print that appears after the ad mentions these types of benefits. $0 premium plans may also have co-payments and co-insurance that can apply. Most members of a Medicare Advantage plan will pay their share of the costs until they reach the plan's maximum out-of-pocket limit. It is important to review the plans available in your area. And now, they urge you to call now to see if you qualify. When you call the number listed on the ad or in the commercial, you may be transferred to a licensed insurance agent. Is the agent a resident of the community you live in? Probably not. A person who does not live in your state can obtain a health insurance license for your state. They do not need to be a resident. You will be asked questions to see if you qualify. They can even sign you up for the plan if you qualify over the phone or internet. But what happens when you have a question for your agent? Can you reach them when you need them most? Aha. Use a trusted and local resource. A local and trusted Medicare insurance agent can be a valuable resource. Most independent agents are appointed with multiple companies and offer several plan options and coverage. Your local agent will know the area you live in. Depending on what type of plan you choose, you may need to understand the network of providers available under the plan benefits. A local agent can help you navigate coverage and provide information that is totally reliable. Medicare plan options and the benefits offered are not the same in every state. They are often not the same in every country. Contact a local Medicare insurance expert to explore the options available in your area. And here's a question for our local folks here on our team as we present this today. Given what I just read, is anyone in particular come to mind? We know who I mean. Okay. Misleading ads. There he is. Super Bowl winning, guaranteed winner. New York Jets, Hall of Famer. He'll get your attention. Misleading ads. Seniors are being bombarded with television commercials from these private insurance companies, sometimes posing as Medicare and often using likable celebrities to sell their Medicare Advantage plans. When you read the fine print, it becomes clear that these plans are not affiliated with any government program or agency. If you look close at the fine print on this panel, not affiliated with any governmental program or agency. Plan availability varies by region and state. Transportation to plan approved locations. That's on the screen, but the last panel was a screenshot of one such commercial featuring Joe Namath. It's difficult to read the fine print. Does anyone think a senior can actually read this while Joe is speaking and other text keeps changing? Seniors may believe they are calling a real Medicare representative who has their best interest in mind. However, the representative's goal is to convince seniors to select their Medicare Advantage plan over original Medicare by touting that they offer all the standard coverage of Medicare plus additional benefits with a lower out-of-pocket cost. This leads to many home medical equipment providers discovering that they must fight for every claim and that they face agencies using delay tactics or denying claims. Many plans reimburse at unsustainable rates when they do pay. Well, we're getting down to it now. No question that you take a big gamble when you sign up with a Medicare Advantage plan. If you're lucky and are healthy, you can save money because you won't need to buy supplemental coverage, as most people need to do in traditional Medicare. But if you get sick, you might find that you can't see the doctors you want to see. Your plan refuses to pre-authorize procedures your doctors say you need. And if you get care, the copays and deductible adds up to thousands of dollars. Medicare Advantage plans generally offer some benefits that traditional Medicare does not offer, which is an attraction, but you are trading away your ability to see the doctors and use the hospitals you want to use anywhere in the country without worry that your care will be covered. Moreover, Medicare Advantage plans can sometimes take a narrow view of what's covered, refusing to pay for services that traditional Medicare pays for. And the data show that they tend to offer lower quality care. If you need nursing home care or home care, you're likely to find that the network providers are of poor quality. Medicare Advantage plans maximize profits by paying as little as possible for the care they provide you. So that can often mean they contract with poor quality providers. Namath makes it sound as if he's working for Medicare, that he's helping you. He does not explain that he's trying to get you to disenroll from traditional Medicare, the public health insurance plan. What's worse, he does not explain that if you leave traditional Medicare and enroll in a Medicare Advantage plan, you very well might not be able to switch back to traditional Medicare. Unless you live in Connecticut, New York, Massachusetts, or Maine, if you are in poor health and need costly care, insurers that sell supplemental coverage do not have to sell it to you. Wow. And P.S. for all of this, the Medicare Coverage Helpline, which our Super Bowl champ was touting, is owned by Together Health, PAP LLC, which in turn is owned by Health Insurance Innovations. Health Insurance Innovations is enmeshed in 2 class action lawsuits. It allegedly bilked Americans of millions of dollars. The FTC, Federal Trade Commission, ended up shutting them down last fall. That's why I put here, yikes. Okay, so here's some of the comparisons. Original Medicare plus Medigap supplement that we need to buy. We have a check mark by higher premiums, but no copays. Freedom to choose your doctor. No referrals necessary. Now we're going to get an X. Some routine services are not covered, like vision and hearing. And also, it's covered anywhere in the US. Now, Medicare Advantage, for example, generally lower premiums, but has copays. No. May be restricted to a network. That means it's not good. May need referrals for specialists. Now, the one check mark they do have is may include extra benefits, including vision, hearing, and fitness, which we hear in those commercials. And also, emergency services are only outside of the service area. There's some comparison. Here's a couple more. This is from United Healthcare. The original Medicare versus Medicare Advantage. You can see original Medicare, parts A and B, which is provided by federal government. See, Medicare Part C, which is Medicare Advantage, is private insurance companies. That's why there's so many of these commercials on TV, because that's private insurance. They're like selling a Jell-O or Gatorade. They got to get out there and advertise to make sure people sign up for it. If we go down and we'll see original Medicare includes parts A and B, which we know, those of us that are of age. We have some youngsters in the audience here that haven't done this yet. Part A is inpatient care in hospitals and skilled nursing facilities, hospice care, and some home health care. It's Part A. Part B, doctor visits, outpatient hospital services, durable medical equipment, some preventative health care. And now in Medicare Advantage, we have, you could see the list here. I don't have to go through all of them, but we have vision, hearing, and dental, gym memberships, disease management programs, and 24/7 access to healthcare professionals. In our original Part A is free for most people. The standard monthly premium for Medicare Part B enrollees is $144.60. You might have seen that number on one of the commercials. He actually mentions the $144 being added back to your Medicare if you're in the Medicare Advantage plan. Medicare also charges deductibles and copays. And for what it costs, each Medicare Advantage plan sets its own premium in addition to your Part B premium. Plans have predictable copays and coinsurance. Our annual cap on out-of-pocket expenses for original Medicare, no. Generally speaking, Part B covers about 80% of a person's healthcare costs, leaving them to cover the remaining 20% out of pocket. And for Medicare Advantage, is there any annual cap on out-of-pocket expenses? Yes, Medicare Advantage plans are set an out-of-pocket maximum to help you predict how much you may have to pay for healthcare services each year. The limit depends on the plan, but can't be more than $7,550 in 2021. So there's a lot to be considered if you're buying into the commercial and you feel like you want to go to the Medicare Advantage plan. As you've heard me say earlier, if you're lucky and you're healthy, it may benefit you to do that. So what do you think? Is it for you? How about the commercials? Medicare Advantage. And for me, that's it for now. Thank you for your kind attention. Thank you. Now, there's probably things that some of you want to say, and you want to deal with anything that I just went over. We have a resource in our group today, and I'm sure he'll comment on some of this as much as he possibly can without.
Okay. May I make a couple of comments?
Yes, please.
There's some kind of music going on in the background.
I'm sorry.
Oh, is
That's,
it you, Mike? Sorry.
yeah, I'm in a Panera and my microphone is picking it up.
We'll live with
Okay.
it. For his expertise, we'll live with the music.
Yeah, I'm sorry. Let me say that the presentation was really good. The information was really good. I want to update a couple of things. The Medicare Part B premium for this year is $148.50. And in the presentation, it was stating 2020, it was 144. So each person on Medicare is going to pay the 148.50 regardless as to whether you're on original Medicare or Medicare Advantage. You're going to pay the 148.50 regardless. The second thing in the presentation I do want to clarify is that there was the comment that was printed that says that a Medicare Advantage may refuse to pay for certain services. By law, Medicare Advantage must pay for services that would be covered under Part A or Part B. They have to be covered. So if Medicare would cover it, the Medicare Advantage must cover it. The difference is, or the key is, how it's covered. It's not will it be covered, it's how it will be covered. Now, how means, do you have to go to certain doctors? Can you only have it done at a certain hospital? Are you limited as to the number of days that you're in a skilled nursing facility? So it's not that you're going to get less coverage of items that original Medicare would cover. It's how those items are going to be covered. Now, Medicare Advantage in Cuyahoga County, in which most of us live, Chris is in Summit County, there are 71 different plans available in 2021 in Cuyahoga County. And I believe in Summit County, there are 77 different plans, and they all want you. And it's interesting because I'm getting ready to graduate to Medicare, and this is what I got in the mail this past week. So those are the solicitations that I received this past week. Every company wants my business. Why is that? Why is Medicare Advantage promoted so strongly? It's all about the money. Medicare pays approximately between $600 to $1,600 a month per enrollee to the private insurance company. So you do the math. You know, we're talking $10,000, $15,000, $18,000 a year that the federal government is paying the private insurer to take care of that Medicare beneficiary. Now, that range, 600 to 1,600, has some little carrots that can be included. So based on the benchmarking and the quality of care and what kind of complaints that company gets from the consumer determines whether or not they're going to get bonus money or additional money in and above the $600 to $1,600 amount. Now, why is Medicare paying that kind of money to private insurance companies? Because we all know that the federal government cannot control costs. And prior to the pandemic, and I don't know what the latest data is, but prior to the pandemic in Northeast Ohio, where there's probably over 250,000 Medicare beneficiaries, the federal government was paying out over $16,000 a year per beneficiary on average. You might say, well, I just take baby aspirin, or, you know, I go to the doctor once a year. But what about the person that had bypass surgery, joint replacement, a transplant? So the federal government was paying out on average of $16,000 a year in Northeast Ohio. Now add to that all of the pandemic cases, and what demographic suffered the most from our pandemic? It's baby boomers and the greatest generation. And so all of that additional cost has not been made public, but I can say that about a week ago, the Medicare trustees announced that because of the pandemic, on paper, it now looks like the Medicare Trust Fund is going to expire in the year 2026.
Oh my.
5 years away. And so what happens is the federal government, rather than paying this uncontrolled amount of claims, they have a fixed formula and they will pay a fixed amount to the private insurance company, and they outsource the responsibility to the private insurance company. And if you sign up for a Medicare Advantage plan, don't expect Medicare to pay a claim. They've washed their hands. They're still collecting your $148.50, but now they've outsourced your coverage to the private insurance company. So Medicare Advantage was actually created in 1997. It used to be called Medicare Plus Choice. It was signed into law by Bill Clinton. And it really didn't take off, however, until 2003 in the Bush administration. They tweaked it some and they changed the name from Medicare Plus Choice to Medicare Advantage. And now a very large segment of our Medicare age individuals are in Advantage plans. Ohio is one of the highest populated states as far as Medicare Advantage. Close to 40% in Ohio who are on Medicare have an Advantage plan.
Wow.
And the reasons were sort of already noted, that you get a lot of additional benefits that Medicare doesn't provide: routine vision, routine dental, hearing aid benefit, transportation, meals, but at what cost? I have too many stories of people that were enamored with all of the so-called freebies, and they forgot to check the most important thing: is their doctor in the network, or are there prescriptions on the formulary?
Mhm.
Because once you lock into a plan without a few exceptions, you're pretty much stuck with that plan for the balance of the year.
What's
So-
your experience with leaving Medicare and going to Advantage and then trying to come back again?
This is something that infomercials or TV commercials or seminars that are held by various insurance companies fail to explain to the consumer. You can always go back to original Medicare from Part C. You
Okay.
cannot go back and get a supplement automatically. You have two opportunities guarantee issue to get a Medicare supplement. The first opportunity is when you first activate your Medicare Part B. So when you first turn 65 or you're retiring from an employer-based plan and you activate your Part B, you have a 6-month window in which you're guaranteed coverage. No medical questions can be asked. The second opportunity, and I call this the Medicare test drive. If you started with a Medicare supplement plan and then changed over to a Medicare Advantage plan to give it a try, as long as you haven't had the Medicare Advantage plan for more than 1 year, you have guaranteed rights to go back and get a supplement again. If not, you're now subject to medical underwriting. And the medical underwriting is pretty strict. You know, if you have a heart condition, have had any form of internal cancer, if you've been hospitalized within the past 2 years, you're probably not going to be able to get a Medicare supplement.
Wow.
So I strongly encourage people, especially in the middle of the year, people that are aging into Medicare, June, July, August, they're sort of enamored and they want to go with the Medicare Advantage. I try my best to convince them to start out with a Medicare supplement. And then at open enrollment, which rolls around October 15th through December 7th, then we can switch them to a Medicare Advantage and they can try it for a year. That way they've guaranteed their insurability for a Medicare supplement.
Well, thanks for sharing that. I'm wondering, has any of us been tempted to move to an Advantage plan? Or, I mean, I know we all listen to Mike's advice, but Mike actually did not say not to.
Well, with full disclosure, I have 3 family members that are clients of mine, and all 3 are on a Medicare Advantage. There are three determining factors. So if you sit down with me and discuss which route you want to go, I'll say there are 3 determining factors. Number 1 is economics. Can you afford to pay an ever increasing cost for your Medicare supplement? Because your Medicare supplement is based on your age, and every year you're a year older, your premium's going to go up. So you may have started $20 for your Medicare supplement, excuse me, but now it's 175, it's 180, and usually when it gets around $200 a month, people who see all of these commercials and hear that their friends are not paying anything for a Medicare Advantage plan, now it becomes more relevant to them. So number 1, economics. Can you afford to pay a fixed premium for the Medicare supplement, whether you're using the coverage or not? And in addition to the supplement, you also have to pay for a separate standalone Medicare Part D drug plan, D for drug. So that combination cost may be $175, $200, $225 a month. And now that $0 premium may not look quite as bad. So number 1 is economics. Number 2 is your lifestyle. Now that you're retired or semi-retired, are you going to be a snowbird? Are you going to spend 3, 4, 5 months out of the year in Florida or Tucson or the Carolinas, or you're going to take the RV and just drive the country? You're going to spend time on the coast with the kids and seeing the grandkids, and you don't want to have to monkey around with copays. You don't want to have to check and see if a doctor in Idaho is going to be in the network. You want the freedom to be able to go to any doctor, any hospital in the country or U.S. territory. So financial, economic is the first consideration. Lifestyle is the second consideration. Third consideration is your health. Are you chronically ill? Do you have multiple health conditions in which may require hospitalization, constant testing, treatments? And I can tell you, I have close to 900 Medicare clients. So I've got clients that have had everything. And so I've got clients that have been on kidney dialysis, that have had transplants. If you were to talk to them one-on-one, every single one of them would say they would rather be on original Medicare, and they don't care what the premium is, because they would rather have the freedom to have the treatment and not have to be worrying about copays and balance billing.
Yeah.
So those are some major considerations: economics, lifestyle, chronic health or your health condition. I have husband and wife couples. One will be on a Medicare Advantage and the other will be on a Medicare supplement. Some people say, I don't go to the doctor. I'm not taking any prescriptions. I'll take my chance. And I like the fact that it's a $0 premium. I'm picking up some freebies, and the prescription drug is built right in, and I'm not paying any additional costs for the prescription drug. So there's not exactly a right and wrong answer. It is a personal decision which requires you, which necessitates you not making that decision alone, but talking with someone who can explain all of this information to you.
Hey, Mike,
Yeah.
I think that somebody should explain the donut hole, because I run into that a couple years ago and you explained it to me and I had to go change medicines.
Well, whether you're on a standalone Medicare Part D prescription drug plan, or you're getting your Part D through your Medicare Advantage plan, every single one of those plans is subject to what's called the donut hole, the coverage gap for prescriptions. And that might be something for another time to go into more detail. But I do want to mention one more thing before I close down for the day. Excuse me. And that happens to be the enticing freebies that are mentioned on the TV commercials and by our celebrity professional athlete in his commercial. There is a lot of fine print. For example, free transportation. That may be if you've been admitted to the hospital and you need transportation home from the hospital, or free meals. The free meals may only be available after you've been admitted to the hospital and released to home. The vision benefit, the dental benefit, the hearing aid benefit, those are all very narrow networks. But the thing that gets people's most attention, and I get the most calls, I've got a client that lives down by you, Chris, in Stowe. And since January, she has called me 4 times. She's in her 80s. She's called me 4 times. She forgets that she calls me about this. She sees the commercial that talks about getting money back to pay your Medicare Part D premium, or sort of getting money reimbursed toward your $148.50. And that really gets people's attention of getting that money back. Well, very few people are eligible for that. Number one, it's only available in certain counties in the state of Ohio. Number two, most of the people that get that back are also eligible for Medicaid. They're called dual eligibles. They're both on Medicare and Medicaid. And number three, the amount of money that you may get back is $20, $30, $40. And so, you know, that's a great teaser that you may be eligible to get your Medicare Part D money back. Well, are you living in a county that allows it? Are you a dual eligible? And even if you are getting a sizable amount back, is your doctor and hospital even in the network? So a lot of fine print, and thanks for letting me just ramble on, Tom.
It's hardly rambling. I mean, although it does seem like you buttressed everything that I said, I don't think you had any criticism about it. And I know each of the sentences you could have commented on as we went, and you waited to the end, which was nice. And I think people should look at these commercials in the proper light, in which they're selling a product. It's not a government agency. They're selling a product like they would like a Peloton or whatever, and they want to make it look as attractive as possible. And they're probably succeeding to at least get people to look at it and follow these commercials. One of our members, Ray, emailed me, and he wanted to make a comment about it because he wasn't going to be able to be here today. But he says that he's absolutely sick of watching this many commercials about a product that he knows is they're telling you truths, yes, but they're not giving you the whole picture. Well, you know, what advertising really ever does. They want to put their product in the absolute best possible light. And I think they're doing that. I mean, it's colorful, and they even got Captain Kirk to do one of these. And JJ from one of the 70s sitcoms. So everybody's in on the act, trying to get these people's attention. And now we know why, because this is provided by insurance companies, not by the government.
Let me, just a word of warning.
Yeah.
Do not call these numbers or respond.
Mike. There you
Sorry
go.
about that.
Yeah.
I was saying you have to be really careful with the mailings that you get. These companies in their marketing endeavors try to make it look like an official government mail reply or publication. Once you sign one of those cards or you call up the 800 number, your information is now going to be disseminated to probably hundreds of agents. It's my understanding that the Medicare coverage helpline is not an actual Medicare insurance agency. What they do, they get the number and they sell leads. And so when you call up and they sort of screen you and get your information, they're going to sell your information to hundreds of insurance agents that may be signed up in their network. And so Joe Namath and this particular entity, I believe, and I want to be careful in saying this, they're not the ones actually going to be helping you. They're just selling your lead information to other insurance agents. So you're going to be inundated. And for those of you who've worked with me, know that before I can share specific plan information, I have you complete what's called a scope of appointment form. The government requires a scope of appointment. I have to have prior written permission to discuss specific plan information with a Medicare beneficiary, and I must keep a hard copy of that permission slip for 10 years in case I'm ever audited by Medicare. And I'm not permitted to initiate a solicitation. So many times I've had clients, they'll say, hey, call my sister, or my brother needs help. Here's his phone number. I'm not allowed to initiate that contact. I can't even initiate with a text message or an email. I have to say, have your brother, have your sister, have your coworker call me, and then I can return the call. So when you respond to an 800 number or fill out one of those cards, you're actually allowing them to contact you personally in a solicitation. So be careful with the 800 numbers and the mail reply cards.
Sure. Wow. Good advice. Great advice. And thanks so much for sticking around till the end. Thank you, Mike, of course, for your expertise. Thank you, Scott, for being here. Thank you, Chris. And thank you, Trina. It's always wonderful to have you here. And that's it for this Tuesday about Medicare Advantage. And maybe you could watch this again and get more information about this. So when you watch these commercials,
I gotta go. I'll talk to you guys later.
Tempted. Thank you, Chris.
No, don't you.
I understand. Okay, so that's it. I'm gonna
Good presentation.
YouTube. Those of you that want to stick around for another minute or so, that's great. But for the YouTubers out there, thanks so much for staying here. We really appreciate it. Thanks so much. Subscribe, click the bell, and you'll be notified when another video goes up. We have all sorts of videos you could watch. You could be entertained, and you could probably learn something. Information and entertainment. Isn't that, after all, what we're after? Thanks so much, and we'll talk to you again next Tuesday morning. Thanks.